finally made it here! All that winter training!
First timers, this is the Boston Marathon. You will be greeted.
So I remember hearing an overhead announcement saying possible explosion in Copley. Stay tuned.
The only thing we heard was that there were 2 explosions at the finish line of the marathon, and that's all we knew.
We thought it could be anything. It could be a firework was set off. It could be anything.
It was eerily calm before the first patient arrived, and we were all anticipating that initial kind of surge.
And as more facts came in, so did the patients. And it became clear that we had to discharge as many patients as possible that day in order to account for the influx of patients that we were about to have.
And it happened very quickly, and patients started coming in, and they just kept coming, and you never knew what was going to be next. Were there going to be more? Was this it? Was this the last one? You didn't know.
My question to myself was, am I ready for this?
The senior resident who was working that day asked me to stay with him sort of at the front of where all the entrances were and just help him triage patients.
I wouldn't say it was frantic. People were methodical and thoughtful about what they did, but we knew we had to act quickly.
There was kind of blood everywhere. There was clothing everywhere.
What we were seeing was blast injuries, so burns, shrapnel, large lacerations.
A lot of lower extremity injuries that you really did not know what was going on because there was just so much soft tissue missing.
I work in foot and ankle division, so this is sort of us. We went down to the ED to help out. We didn't realize how big of a deal it was until we got down there.
These were essentially battle wounds. They had shrapnel, ball bearings in them, things that you wouldn't see, in someone who had a motor vehicle accident.
I'm a veteran of the Iraq War and saw a lot of casualties, not too dissimilar from those at the marathon bombing.
Patient after patient after patient that had significant injuries.
It was hard then because nobody had a name, nobody had a medical record number.
We have an identification system that assigns unidentified male or female to a patient along with a long number. On Marathon Monday, when we had all of those patients coming in so quickly, it was very difficult to know the patients by that long number. There were lots of unidentified males and females.
All the while you're trying to coordinate radiological findings with the x-ray techs that are there, with all of the different teams that are there.
So it was a lot of people all in the same outfits and not necessarily knowing who everybody was.
Happily, we were able to get it all worked out, and our physician assistants and our nurses did a great job of making sure that the right patient got the right treatment and that the tests were all squared away.
I think that the months and the years that many of our PAs have been present working and practicing in that team model really blossomed that day when we needed that the most.
6 to 4 millimeters. You can follow my fingers. Great. Pupils are 6 millimeters.
In the moment, you need to figure out the quick, pertinent positives of, did this patient have a vascular injury? What are the bony injuries? Does this patient have other injuries that they're distracted by?
Besides physical injuries, a lot of the patients, they were in a state of shock, as we all were. And in some ways, we would have patients who had horrific injuries, and yet they were silent and calm. And partly we realized it's because their mind was still processing what was going on.
We made a complete collaborative effort with ortho, trauma, vascular, plastic surgery to be able to say, is this patient's limb salvageable?
And there was such teamwork going on. I felt so proud to be a PA in that moment.
On a normal day in the emergency department, we really depend on our PAs to provide high-quality patient care. We could not operate our emergency department without our physician assistants.
We're going to take great care of you.
And on Marathon Monday, it was no different. We couldn't have done as good a job as we did without our PAs.
When we first heard about it, I was a little nervous that I didn't know how we were going to handle it. And after the fact, I realized that we were trained for it.
One of the great statistics that we've had is that the people who were alive at the time that they made to the hospital stayed alive. Nobody died if they made it to the hospital alive, and that's a huge testament to our medical community.
I got in my car and drove home that day, and I was in shock at what I had seen, and then you turn on the news and you think, it's not just the 39 patients that we saw in the emergency department, it's over 200 others, and 3 lives were lost.
It was quite an emotional day.
You see that on the TV, but it was very different when it's your home.
It's not like we saw them that day and never saw them again. We followed these patients for months and we still see these patients.
And I went down to see the memorial that had been set up there, and that's where it really hit me. And I broke down in tears at that point, but it was tears of disbelief and sadness, but at the same time it was also tears of happiness knowing that I was able to discharge all the patients out of the hospital. I had cared for them as best as I possibly could, and I was hopeful that they were going to go on, lead great lives and be able to live their life like they wanted to.